Okay, so we're going to take these lessons, instead of doing a full focus lecture, I think I'm going to do that in the future too, but we're going to take these lessons and say, how can we take the challenges that we're currently having and that potentially our kids are having, one, shed some light on some of the challenges that might be there, and two, understand them from a brain-based or neurological perspective a little bit more, just deepen our understanding, or introduce people to the understanding that there's a reason when we look at the brain, how the brain develops, how the brain processes, there's a reason that we're having specific challenges, maybe more now, believe it or not, maybe less now, maybe different now. I know Abby's like, less now, maybe. And so we need to really look at, what do we know? What does the science tell us? How does that apply to my child's developing brain or my brain, right? Like looking at the science, what does that specifically look like? And as in terms of your day-to-day, what are you seeing? What are your behaviors? What are your challenges? And then what do you do about it? So that's what we're going to do. So our first objective, since we're going to take these in bite-sized pieces, and then over the next few weeks, we're going to talk about specific, like even more specific challenges or deflections. So if people have a question about, hey, my kid is super hyperactive right now, or super, super clingy, or super aggressive, and I say right now, but it could be not just right now, you know, this is something they maybe struggle with or are challenged with like before this time. It's just, we know that there's this increased stress that comes in many different forms right now. And so we know that there is a possibility and a high likelihood that we're seeing increased or different behaviors, or termed a different way, increased or big behaviors. Oh, I forgot to say that, because of, just a second, Bree, because of the time we're living in right now. So we're just going to go through kind of in an intro to this. We're going to go through some of the what science tells us, what we know about brain development, what we know about, and some research that's there about stress and brain development. Say, okay, like, let's boil that down. What does it mean to me? What the heck do I do about it right now to help my kid? So first of all, if any of you have any questions, thanks Bree for telling me this. If any of you have any questions, you put them in the chat, because we have you muted, and right, Bree, put them in the chat. And if you want them, know that if you put them in the chat, they're going to be seen by everybody. If you want them private, that's totally fine. If you want to remain anonymous, then you want to just ask me the question. I will not repeat your name to the group. You can change it and make it so it's to just me, Amy Spoelstra, and type the question. I'll come back. If I don't answer the question right here when we're doing it, we'll look at the questions at the end. And my objective here is to keep this pretty short and efficient for you guys, because when we're in our brain stems, when we have stress, we don't need a ton of content shoved down our throats or into our brains when we're not totally in a place of efficient learning. So I want to keep this really simple, but give you a lot of depth of knowledge, and go like, what does this mean to me? So our objectives of this talk are really looking at the impact of stress on the brain. So we're going to look at that. We're going to look at the impacts of stress on the brain, what really happens inside the brain and the body as a result of stress. What does that mean to you? What new behaviors or existing behaviors may you be seeing, and why does that make sense? And we're going to do that by teaching you, just introducing you to the first hierarchy of brain development, so that we can unravel this and boil, I always say, like, boil the complexity of neurology and development down to something that is pretty simple to understand and can help us tie in like the specifics, the specific challenges, the specific behaviors that you're seeing in your home with your child, with yourself, and then know how to formulate a game plan from there. And then we're going to do, you know, what do we do about it now? So first of all, let's just talk about stress in the brain. So here's what we know. We know, take this time out of it, we'll come back to that, but we know that stress, physical, chemical, emotional stress, first of all, physical, chemical, and emotional stress are all responded to in the same way, neurologically speaking, at a cell level. Meaning when we have stress, physical, chemical, or emotional, our body has a response. Our body, our nervous system, our neurophysiology, neurometabolic systems, like our systems in our body have a response. And that response is fight or flight. Fight, flight, or freeze, actually. And so we go into what we call this sympathetic or fight or flight response. That's a totally healthy, great, adaptable, wonderful, perfect response. That's what we want. We want our bodies, our brain telling our bodies, controlling us down to a cellular level, going into this sympathetic dominant response. Here's what we don't want. We don't want so much stress or something happening inside the body that's altering the way the body, the brain, the body, the cells are fluctuating between sympathetic fight or flight and parasympathetic rest and recovery. What we don't want, we do want stress happens, brain says to body, nervous system responds sympathetic, fight, flight, freeze. Super good. Awesome. That's what we want. What we don't want is to be stuck there. We don't want to be stuck there for a long period of time. And what can happen is, one, there's just too much stress. And so we are having a good response, but we're just there too much, right? Too much physical, chemical, emotional stress. They're here. And so we have this response. That's not good. The other thing that can happen is that we can have this, this stress event, this physical, chemical, emotional stress, and we can have something happening within the body that doesn't allow us to easily or efficiently go to that fight or flight and then come back to the parasympathetic. So we don't have this healthy dance or balance between fight or flight, rest and recovery, fight or flight, rest and recovery. This is called adaptation. Adaptation, adapting to our environment, to our stressors, physical, chemical, emotional, everything that comes our way. Adaptation is health. It all comes down to the ability to adapt to what's happening. Now, what we know is that if we have too much stress, it can negatively impact the way that our brains and bodies are doing this adaptation, and it can shift us over to this sympathetic dominant response or this fight or flight way too much. We already talked about that's not good. So then we have a brain, could be our brain, could be our kid's brain, whoever, that because there's too much stress or there's something happening inside that is not allowing me to fluctuate between two, I'm living over here more of the time in this fight or flight. That's a problem, because when we live in this fight or flight, what happens is we literally have different activity inside of our brain and inside of our body. We have more activity and more function, blood flow in the brain stem, less in the front of the brain, the prefrontal cortex, the seat of executive function, right? Organization, planning, prediction, connection. Right? We have less activity there, less activity in the cortex, more activity in the brainstem when we're in fight or flight because we're in survival mode. Now, that's very problematic for everybody if we're stuck there, right? Because that's altering the way that our body on a cellular level, our metabolism, it's altering the way our metabolism works. It's altering the way our digestive system is working, our endocrine system, so our hormones, our immune system, super important, because when we're stuck in this fight or flight, this sympathetic dominant state, then we are decreasing our body's ability to go into this rest and recover and repair. Now, what we're going to talk about today is how that specifically impacts our kids who don't have fully developed brains yet. That's really problematic. And what we know, the research tells us, is that if we have stress, increased stress, physical, chemical, emotional stress in utero and in early life, that it can negatively impact the way the brain moves through development, and we see long-term consequences later in life. Let me break that down. If we have, there's massive amounts of research on this, and it's in physical, it's in chemical, and it's in emotional. There's research in all of those realms that says if we have increased chemical, increased physical, increased emotional stress while a baby's in utero or in early life, even if the stress doesn't still exist, but it was there, we know that there's research that shows us that the long-term consequences are negative, meaning we see decreased language ability later. We can see decreased emotional cognitive ability later, learning, emotional regulation issues later in life, mental health. Stability and mental health later in life. We see, and there's the ACEs study is a great one to look at. The ice storm study, and we can post links to these if you guys want, is a great one to look at. There's literally research coming out every day on this topic. I got an alert this morning, and I got 10 new articles. I haven't read them yet. 10 new published articles on stress and development. So it's really, really important. And we understand that here's the thing we understand. It's not just the fact that we have stress, that we're in the midst of stress. And this is a time of increased stress. Like one of the studies that I like to talk about and teach on is called the ice storm study. And we can post a link to that. And what this study is, it was done in, I think, Quebec. And it was, it happened, this big ice storm happened in 1998. And this study was published in, I think, 2008. And so what happened is there was this big ice storm. And so it was like this natural disaster, right? And so everything was shut down, like there was, people were losing power. People didn't know when they were going to be able to like get back to normal. And it was like a 30 to 60 day event where people were just like kind of shut in their houses and didn't know, there's a lot of stress. And what they did was they looked at the mothers who were pregnant at that time, during this time of increased emotional stress, and they took long-term measures at 5.5 years, I think was the last measure. They took 5.5 years old of those babies that these moms were pregnant with. They were in utero during this stress event, and then the stress event was gone, and they went on, and everything was fine. But they took measures of cognition, emotional intelligence and regulation, language development, and these categories at 5.5. When these same kids were 5.5, and what they found was when there was this increased emotional stress of the mom in utero, when the baby was in utero, we saw decreased function or ability in these kids. Well, I don't tell you that stuff to scare you. I'm telling you that because what we need to know is, why is that? We need to ask the question, why is that, and what do we do about that? And so first off, we already know that stress impacts brain development negatively. It's not just in utero, it's not just emotional stress, it's not just natural disaster, but that's kind of similar to like now, right? But what we need to look at is what actually happens inside the brain and inside the body as a result of the stress. Because it's not just the fact that, oh, there's this stress and I happen to be in the vicinity of that stress, or a child happens to be in the vicinity of that stress, therefore they're going to be negatively impacted. What it is, okay, there's this stress. What's happening inside the brain and inside the body as a result of that stress that is potentially altering the way that we are processing our world, and the way our brain is functioning, and the way that a child's brain moves through development. What's happening? So let me tell you, 2 huge things we know that happen that have to be looked at here are, one, we have to look at what happens in the neurology. We know that when we have a stress response, we can have this thing called neurostructural shift, particularly in the upper 2 bones of the spine. It's like a fuse blowing. All this stress happens, it's like a fuse blowing. We have to reduce the input that goes to the brain. This is called a subluxation or neurostructural shift. We know that this is a response inside the nervous system, inside the spinal cord, brain system, to stress. We know that that condition happens as a result to stress. But here's the kicker. When that happens, when we have this structural shift because the brain says, too much, can't do that, gotta shift. And so it's like a fuse blowing. What happens is, and that can happen in any of the bones of the spine, we're really interested in looking at the brainstem level because we find a big correlation there. And what happens is it changes the way the brain is being fed information about the outside world. It literally changes, when we have this neurostructural shifting, it literally changes the way that the sensory systems are able to communicate and feed the brain. It alters those messages being sent to the brain. So here's the thing, that's a problem, because we know that the brain is not fully developed at birth, right? We all know that. We know the brain is not fully developed at birth. When a baby is born, they have more activity in their brainstem. Their brain is not fully developed, not full activity. They have activity everywhere. It's just not efficient, connected, full brain function. What happens as we move through development is that the brain starts to develop like this, bottom up, back to front, inside out, right to left. It starts to grow. And the way it grows, you all know this, is we're feeding it information. We're feeding that brain information from vision to touch to auditory, so sound, to love, to connection, to all these things being fed, to where my body is in space. It's being fed information. We need, just like a flower is moving through development, it's opening up, and it needs to be fed, right? It needs to be fed water and sunlight and nutrition for it to open up. The brain needs to be fed sensory input, touch, movement, body, spatial awareness. It needs to be fed all of this information to help it move through healthy development. And if that information is altered because we have this stress response, i.e. subluxation or neurostructural shift, if that is altered in any way, it can change or skew the way the brain receives information. It changes the way the brain is being fed, and that can alter the way the brain develops and later create a challenge. Super important that we look at that. So, hey, the stress is here right now. We know that. But what we need to do is not just be afraid of it, we need to understand it. How do we support this developing brain and our own brain appropriately so that we cannot get stuck in that fight or flight, so that we cannot be impacting negatively the way the brain is moved through development? And then if we do see that, what do we do about it? So that's one thing that we're saying. There's stress, what's actually happening inside the brain and the body. That's one thing. The other thing is we can see a breakdown of the gut wall, of the microbiome as a result of stress. So we need to be looking at the gut, because the gut is the second brain. The gut is connected to the brain. We know the gut is really part of the nervous system. A lot of the chemicals created in the gut are created in the brain, right? Or vice versa. The chemicals created in the brain are also created in the gut. We know there's an intimate connection between the brain and the gut. And we know that as a result of stress, one of the things that can happen, especially long-term stress, is we can see a breakdown there. So we have to look at that as well. So this time, right now, when we have all this stress, we want to make sure, we know that the increased stress we can see a resultant long-term consequence of that, but we want to make sure that we're doing everything we can to help the body not shift into that sympathetic, not alter the way the brain is being fed information, support the brain appropriately so that we can mitigate those long-term consequences. And so that's why right now, gut-wise, it's even more important that we're, being and look, we're not judging. Nobody's perfect. I'm not asking for perfection, but eating healthy food, decreasing inflammatory food, drinking water, right? These, I don't want to give you a bunch of complicated things to do, but just try to go more towards the healthy, the non-processed type of foods right now to decrease the stress on the gut during this time, to decrease the stress on the brain. And as far as this subluxation or neurostructural shifting, this would be the time, if your chiropractor is open, or if you don't have a neuro-based chiropractor, and that's the key. We want to have a specific neuro-based chiropractor. If you do, you probably want to be checking in with them if they're open a little more often. You want to be getting checked a little more frequently right now, because we have more stress and that fuse is blowing. And we want to make sure that we're keeping the brain fed appropriately for you and for your kids right now. If you don't have that, that's a tool that we need to get on board, right? That's important, because we're talking about not just right now in stress response. There's stress all the time, right? We're just talking about right now we have a different set of stressors. We have different stressors. And so we need to understand that we need to keep the brain and body reacting and adapting and responding in a healthy way. And if we have a fuse blown and the brain is not being fed appropriately, we're already handicapped on that. We're already behind, because if the brain, just like a flower, if it's not fed the right stuff, we can't expect it to grow in a healthy trajectory or as efficiently as we want it to. So those are the first few things. Now, in order to know, okay, what does that mean to me? And is that happening for my kid, like, or for myself right now? Because I get it. There's this stress response. There's this response inside the body and the brain. And I get it. Okay, healthy food and decrease stress on the gut as much as I can. And get checked and make sure we have a neuro-based chiropractor on board. Super important. Now, what does that mean to me? In order to understand what that means to you and how to know, like, how to get some windows into, is this actually happening with myself or my kid? Let's talk about and learn the first of 8, the first hierarchy of brain development. Let's just get introduced to, there's a way the brain moves through development, and there's a reason for some of the behaviors that your child is having even before this and that you are having. There's a reason you process the world in a certain way. And let's just dig into that with just dipping our toe into brain development in a simple way here. So as I stated before, we know that the brain is not fully developed at birth. We know that. We know that it has to move through a trajectory of development. We know that that trajectory is kind of, we say visualize it like a flower opening up, bottom up, back to front, inside out, right to left. Now, we know there's some things that can impact that negatively. We've already talked about that. But what we want to look at now is, as we're moving through development, what does that look like? What tools do I have? What skills do I have? We already know that my 4-year-old does not have the same tools or is not in the same place in development as I am. We already know that an infant is in a different place than my 4-year-old in brain development. But what we want to know is, what does that specifically look like? So we're going to talk about a typical trajectory of brain development now, so that then we can start to look at what gaps or what that stress response looks like. So we're going to do that on the whiteboard here. So we're going to start by talking about when a baby's first born, they are not fully developed at birth. What is the primary way that they process their world? So I want you to ask yourself that right now. If we were in person, we would have some interaction. But I want you to ask yourself, what is the primary way that the brain processes in an infant when they're first born, or their first year, 3 months, let's say, of life? So the answer to that is they now, of course, they have other ways to process as well. We're getting light, we're getting some vision, there's some visual development that's happening, we're getting touch, we're getting connection, we're getting hearing or auditory input, all these things. But what I'm after is, what is the primary way that an infant, a newborn, processes their world? And that primary way is the thing that happens when you do this to an infant. You do this and they go like this. What is that? That is a reflex. That's them going, it's a reflex facilitated through the brainstem for survival and learning. It's from the bottom of the brain, because we're more active in the bottom of the brain, or our reptilian brain, at birth and in utero. So when we do this, we see this, that's a reflex, rooting reflex. There's a bunch of these reflexes, and they're there to facilitate survival, right? This is to find food. We have a more sophisticated way to find food now, once we've moved through development, hopefully. But if we're an infant, this is a reflex that helps us navigate our world and find food. It's not a cognitive process of like, I'm thinking about I want food. It's a process, it's a reflex that happens. Now, these reflexes, there's a bunch of them. It's like this reflex is the Morrow reflex, that kind of startle one you see with newborns. These reflexes are called primitive reflexes or infantile movement reflexes. They're totally normal. We should see them. And what happens is we see them kind of what we call integrate or go away. As the brain is moving through that development, it's getting more sophisticated as it grows. We don't need those anymore when we have sharper tools. So we start in early brain development with infantile movement reflexes. You guys can see that? So as we move through development and we get more sophisticated as our brain is developing, the next tool that we develop is the next most sophisticated tool that we start putting more of our eggs in this basket, more of our attentiveness to here, because it's way more sophisticated than just being reflexive, is we start to have coordination of our big muscles, which moves into our small muscles. I mean, I held my head up as an infant. I'm now going into tummy time. I'm starting to roll one way and the other. I'm starting to scoot. I'm starting to get on my hands and knees and kind of rock back and forth, which turns into a crawl, which turns into a stand, which turns into a walk. There's a way that we move through this development, and that is when we're putting more of our processing eggs in our movement touch, our motor systems. So we're developing, we're getting more sophisticated, we're moving into movement touch development. We start with infantile movement reflexes. We don't really need those as much anymore when we have a better, sharper tool. Then the next thing that happens is we move into auditory verbalization. Doesn't mean that these things go away. It just means we're getting even sharper tools, meaning I'm putting more of my attentiveness. By the way, this is about year 0 to 1, and this is about year 1 to 2. And this is when we start to develop language, right? When we start to put more of our attentiveness into auditory verbal world, which is way more efficient than movement touch. Here, you know, it doesn't start with sophisticated language, but it does start with, you know, putting more of my attentiveness into, oh, you're making noises at me, I'm making noises at you. We're starting with receptive language, meaning I understand I'm attending to what you're saying to me, and that then moves into expressive language, which is now I am using language to attend to you in a sophisticated way. That's a whole hierarchy of language development there, which is really important, but we're not talking about in this class. But we see this when we have kids with language delays or speech challenges. We have to look back at this initial hierarchy and understand why and where some of the gaps are. So moving on from that is visual cognition. So this happens when we become fully developed. The brain is fully developed. We're operating from a full, or we're starting to operate from a whole brain perspective, and we're starting to put more of our attentiveness into outside of ourself, right? We've become more sophisticated in the way we process the world and with our tools, with these more rudimentary skills or tools. And now we're starting to engage in the whole brain and the front of the brain, the prefrontal cortex. This is the seat of executive function. This is up here in the front of the brain. Let me give you examples of visual cognition. This is our gift as humans with this big frontal lobe. I'm not talking about here visual acuity, like, can I see? Do I need lenses? Do I actually have the apparatus to visually see my world? Is my optic nerve working? Like, that's not what I'm talking about. What that actually happens in the back of the brain. What I'm talking about, that of course is important. If I don't have that functionality, that can skew the way we go through development, of course. But what I'm after here is visual cognitive function, meaning, am I putting my eggs in my mind's eye, in my ability to visualize and see outside of myself and not just be impulsively attentive to what's happening in my own body or the reactionary or reactive, sensory input that's coming in. When we become more engaged in whole brain processing because we're moving through development in an efficient way, then we put more of our processing and visual cognition. Let me give you an example. If somebody is not there yet in their brain development, then what happens is, let's just say something has caused there may be a stress response, changing the way the brain is being fed information. Maybe there's a divorce in the family when we're moving through development. Maybe there was a chemical stressor while we were moving through development. Maybe there was in utero stress. Maybe there was a lifestyle change. Maybe there was anything, a big fall. There was a microbiome issue, an inflammatory thing, a virus at a key point in development. There could be a lot of things. And first of all, I want to point out, it's not your fault. I'm not saying this is your fault. You've done something wrong. And as a mom, I think that's where we all go to first. So I just want you to realize that's not what we're saying here. Everybody has stressors. Every child has stressors. It's a matter of, are we having that stress response inside the body because of the stressors? And where were we in brain development when that stress response was happening, and as it altered the way the brain is being fed information, and therefore altering the way we move through this trajectory of brain development, and therefore altering the way we process our world later. That's the key. Not going, what did I do wrong? Just like, what were their stressors? When were they happening? This is where we can help you by taking an appropriate history and digging into some of this stuff with you guys. What was happening and how are we processing now? So for example, let's say something has blocked a 6-year-old boy from becoming fully developed here. So this 6-year-old boy's primary way of processing his world is living in the movement touch systems and the auditory verbal systems. This is doesn't mean he doesn't have any of this. It just means this is his primary way of processing the world. So what does that mean? Well, if these are our tools that we use to process our world, then that is going to dictate what our behavior is in the world. Meaning, the way this 6-year-old boy is going to process his world is through moving his body, right? Which is going to look like hyperactivity, possibly, hyperactive behavior, moving his body, and maybe talking a lot, excessive language, hyperverbal, or maybe just stimming or sensory stimulating in a way that is more engaged in auditory verbalization, maybe screaming, maybe scripting, maybe having to, make clicks or hum or loud or any of those things, but having to engage more, put more of the processing of this 6-year-old boy's life into auditory, verbal, sensory systems, because that's the primary way this individual is processing their world: movement, touch, and auditory, verbal. You're going to see appropriate behavior. The behavior is not bad. The behavior is gold. The behavior is gold because it tells us, it doesn't mean it's easy, but the behavior tells us what an individual is doing in there. The behavior tells us what an individual is doing in there. How are they processing? What are their tools? How are they not processing? And when does it get better and worse? This is gold. You've always been told that behaviors are bad. Challenges are bad. We need to get rid of them. We need to cover them up, and we need to compensate. We need to work really a lot harder using inefficient tools to be able to fit into this world, to be able to meet an academic demand, to be able to meet a behavioral demand, as opposed to, I'm telling you, this is a new way of thinking. This is different. But it's actually not new to us. This is how we've been doing. This is what the science tells us for a long time. I'm telling you, the behavior is not something we want to just extinguish. We need to understand it. We need to understand it, and then we need to develop strategies by understanding the science about what has impacted the trajectory of this brain development. We just then go, okay, this is how this individual is processing. Here's why, and let's look for clinical clues. Let's look for clues as to how they're interacting in their world. And now let's get to work. Now we know how to gather the right tools to help this individual appropriately. That's what we do in Brain Blossom. That's what we do in Focus. That's what we do. So the first thing is understanding this. Now let's say we have a time, say we're cruising, say the same 6-year-old boy has moved through this and he's doing great, and because we're engaging in and doing all the same things, we're improving the way his brain's being fed information, we're understanding, and we're specifically going in and doing body movements and eye movements to help fill these gaps and move through development to be able to be here in whole brain processing. And let's just say that all of a sudden there's a huge stressor that happens. Unpredictable, huge stressor. All of a sudden there's no school. My routine has changed. I'm at home. I'm eating different food. My mom is there all the time and she's working and I don't know how to connect with her. My whole life is different at home. My whole life is different outside of home. Oh, there is no outside of home. Everything's different. What happens? We move down. We all do this. We move down. Even if we were here and we were not seeing these behaviors anymore because we're cruising along and we're seeing less of them, now we have this huge stress response. We're shifted to that fight or flight. We're potentially getting different information being fed to the brain. We're in our brain stems, and here we are. So we can shift. This can be a dynamic thing. It doesn't mean we're going to live there. We shift down. This is what we call typically a regression. Now, the thing about that, I also am here to tell you, regression doesn't mean all is lost. That's what we always have been told. Stress response, regression, it's scary. We had tools, we had improvements, and now we don't. That's scary as a parent. I understand that. But again, we're looking to this, and this gives us guidance and certainty and confidence because this is science. This is what we know about the brain. And so we know that in times of stress, we're going to be more in our brainstem. And if we're not resilient yet, even those of us who are resilient still see this. Look, my whole life has changed. I've had stressors. There's a lot of stressors happening. I'm getting adjusted. I'm working on my gut. I'm doing the things that I can do to help reduce the stress response or improve my adaptability. But I cannot change the fact that there's stress in the world right now. And so I am encountering that. I'm doing everything I can to build up my resilience. But nonetheless, there are limitations to matter. There are limitations on us. And so it is inevitable that we're going to move up and down on this a little bit. And so what happens is maybe I'm finding myself moving a little bit more, a little bit more movement. I need to move my body more. That's my deflection. That's called a deflective behavior. So it helps me when I notice that I'm in increased stress and I'm not adapting to it. I'm pacing the room. My staff knows it. They're like, I'm pacing, I'm moving. I'm doing that because it's what my brain, it's a very appropriate window into my brain. My behavior is telling you about my brain. So listen, if you guys are seeing some of these challenges before this and during this, maybe you're going, wait, I was seeing this stuff before, but now during this, and you're saying like, wow, my kid's like super loud, like needs to have things like super, super, super loud all the time, or they're really, really scripty, or they need all the time, this connection and language or noise. Understand that this is where they are, and there's a reason for that. And there's a lot we can do about that. First, looking at, are we adapting to the stress? Or do we have that stress response? So we have to look at that first. If you're seeing some movement in this right now, don't think all is lost. Not all is lost. Definitely not. But we need to increase or maybe up the strategies that we were doing before to help build that resilience or adaptability to stress. So this introducing us to this first hierarchy of brain development should give you an understanding more about how to look at behaviors and help to understand what they're telling us about the brain. And if you've seen a change or an increase in behaviors, aggression, emotional dysregulation like anger, this comes from like brainstem, infantile movement reflex stuff. The need to have like constant connection or control the world, or like what mom is doing, or what sister is doing, or just have this very rigid control. That is a beautiful window into telling us that this child or adult is not efficiently using their whole brain. And because there's so much in their brainstem, they need to try to create rigidity and routine and control, or they're completely out of control. And so that's a window to the brain. So there's a lot of strategies. Here, we're getting into the strategies now. The strategies that I want you guys to take are a couple things. One, we have a resource. We'll post it in here, a brain-based parenting resource. It has lots of little lessons. I don't even know how many lessons we have, but we're just continuing to add multiple a week. There are very specific lessons that you can do in your home with your kid. They're not complicated. It's all based on all this complexity that we know in the focus systems and neuro-deflective retraining and brain blossom that we know work. And so some of them are going to be really easy for you. Some of them you're going to be like, that was hard for me. Say, what does this mean to me, and how can I take this lesson? They're short lessons. They're specific action steps. Do them. We want to help reduce the stress and improve prediction, improve control, so that we don't have to drop down on this as much. 2, we're offering anybody on here a free consult with our focus coordinator, Meela, who's over here, who can just help to dig into, all right, what does this mean to you? What's happening with your kid? Can we get a little insight into how we can help you? And then we can develop strategies for you on which way to go with that, and specific things that can help you right now. We are here. We understand this is a time of increased stress for everybody, and particularly for kids. It looks different in kids. It looks different in all of us, but it really looks different in kids, and particularly kids that already have some vulnerability with behavioral learning socialization challenges. This is what we do, and we are here to help. So what we'll do is we'll follow up. You can put in the chat any questions you have. I'm going to close this, but we're going to, for the recording, and then I'm going to answer questions, which we can keep the recording going here, Bree. But what I want you to know is that you will get a follow-up email or call from our focus coordinator, Meela, to see, like, can I help you? What can we do to help you? Can I give you some strategies? We'll also post or email out the brain-based parenting tips. You guys are not alone. Remember, behaviors are a window to the brain. Stress response in the way our brain is functioning and processing, the way our brain is moving through development is normal. It's not that your child is not resilient or is bad, or you are not resilient or bad. We know the science is there. We know that this increased stress can have some pretty negative consequences in the way our brains are functioning and the way we're in the long-term trajectory of development. So let us help you use those brain-based parenting resources. This is a time in history. We cannot let this stress response alter our children's and our future in this way. We have the tools. We can help. Thank you for taking the time to be here. We're going to be doing a lot more lessons on specific challenges through the next few weeks. Stay connected, and then connect with our coordinator, Meela. Okay. Questions. I don't know how to see the questions, but I'm going to look. Okay. I see the chat. If anybody has questions, please type them in. And if you want them to be anonymous, then you can just put it just to me, and I will keep your name anonymous with the question. Yeah, you can unmute yourself and ask. I think you can unmute yourself. That would be fine too.
Hey, Amy, I have a question.
Yep.
Does this undo, like this current stress doesn't undo all the progress we've made in a year, right?
No way.
Okay.
No way.
That's
it's like all of us. Yeah, that's a great question, Abby, and I'm glad you asked it, because that's the fear, right? And that's like especially when we've seen kids have regressions before in their history, and that maybe has, that regression situation, when they had skills and then maybe those skills were altered or changed, or their behavior changed, that time you look back and you're like, wait, that altered the whole trajectory of our life. And then we're in this scenario now where we go, wait, this feels a little bit familiar. Like we had skills and we were just like cruising along, and then now all of a sudden we've got some of these back, or they're different, or whatever. Have we altered the whole trajectory? That's why we're doing everything we're doing. As long as we're improving resilience, we have different tools now, right, than you had before. And we're making sure that we don't have that altered afferent input to the brain. We're making sure the brain is continually adapting. That's why we want people to get checked a little more frequently during this time. And we're using all of our tools, and we know that because of the progress we've made, we have laid down those neural pathways, and all is not lost. Definitely not. We're going to see us bounce back from this, and that it'll look a little different in the current state, but absolutely not. The brain is plastic, and kids are adaptable, and adults aren't quite as adaptable, but they're adaptable.
Thank you.
Sure. Yes, you're welcome. And that's a totally normal fear. And that's one of the things that I want to make sure I'm like really communicating that with parents. Hi, Hayden.
Hi, Dr. Amy.
Hi. I miss you, buddy.
Hey, Coach Michaela's up there.
Hey, Miss Michaela!
Oh, you're on my toe. I need that foot. Okay, go back to recess.
Okay. I have a question.
Yeah.
So I have a kid who is totally stuck in movement, touch, and auditory verbal. Is there like anything specific I can do? Like he just yells. Like he doesn't know how to like say things. He like resorts to yelling. So is there like a specific thing I can do to like help him find an inside voice, for lack of a better?
Let me tell you something. So we're doing Brain Blossom, and can I talk about that?
Yeah.
Okay. So what we're finding is that we have more gap in here, right? In early brain development, which makes sense for his age too. It's just, this is where we are. So we don't have a lot of sophistication. Let me close this chat here. We don't have a lot of sophistication in our ability to use our auditory verbal tools yet. So it makes sense. Just like when a child is learning to walk, are they like super coordinated in their movements and their ability to like regulate and coordinate their body through space at first? No, they're like this and they're falling down all the time and they're like dysregulated, right? They're using this tool, but they're just not using it in a super controlled and efficient way. Well, that's what's happening here. I'm using this tool, which is great, and especially because I know there's been some speech delay, or we were in like we were in speech therapy, right? And so it's like, oh, well, they were saying there's a deficiency here, and I'm saying it's great that he's engaging there, but he's not super sophisticated there yet because we have gaps here. So what's going to happen is, as we continue to get better here, you're going to see this coordination and efficiency improve.
Okay, so I basically just have to be patient.
Keep doing what you're doing.
Yeah.
But that's why I'm not opposed to taking a break on the speech therapy too, because I'm like, hey, we don't want to routinize something. We want to organic development, and we're doing that.
Yeah.
You know?
Yeah, his speech is taking off.
Yeah,
and
it is. Of course
it's not really, it's not because of speech therapy. It's because like being with all those kids, just the environment, and then, you know, like things have changed since he's been in Brain Blossom for sure with speech.
So that's the thing. So like, oh, I just love it. I love this work. So the thing is that, think about that. So he's in this environment. There's all these kids, and he's like hearing them speak, and he's attending to that. But at the same time, he's emerging and becoming more sophisticated here so that he can effectively and efficiently attend to that. As opposed to us routinizing and trying to get him here when he's not here yet. And so all of a sudden, he's like, we're doing this stuff to get him here. And then he's attending to like, oh, I'm in this environment with kids and they're doing these noises and I'm going to do these noises, and oh, that's language, and I'm doing receptive and expressive language, and I'm getting more sophisticated in the way I use this tool as I'm moving here. Just like I'm getting more sophisticated in the way I move this tool, and I'm engaging with that, and all of a sudden I'm just good at it when done in the appropriate way.
Right.
So good. So good. I should have one of these like behind me all the time, so I can just be like, it's always in my head. So that was a great question. I loved that question.
I really liked it too. My son, he has had delays. Basically, his Dr. Amy has cared for him since he was just under like 9 months, 8 months or something like that. But he had significant delays in his gross motor. And then now introducing speech, we've actually been recommended to go to speech therapy. And so when that happened, I of course go to Dr. Amy because I was like, oh, his daycare is saying he might need speech therapy. And I thought I understood everything he was saying, and, but I know that there's a delay here. And and then we started working the focus steps. So I looked at his gut. We decreased his dairy, which I think was a huge inflammatory source for him. We started doing this stuff at home, just like the lower brain stuff. And already it's like I'm hearing more emergence and attentiveness into his speech, which is amazing. And also the environment, like you were saying, just now that he has more appropriate tools and he's in an environment with kids who are speaking more. It's a cool combination. So
he's able to attend.
Mm-hmm.
And he's a really big kid. There have been some stressors. And we all have a different ability based on our genetics, our epigenetic factors, to adapt and handle and be resilient to the stressors and either have those stress responses or not. There's not like an exact, like everybody's here. It's just different for everybody. And so, we're doing all of that. And like, he was a little late in his coordination of his movement. Everybody's putting fear in Michaela, and she's going, wait, what do I know about brain development? Okay. He's got a lot of body to control, and his brain's catching up to that, and he has some stress responses. And so it's like, okay, we just continue to work that. So it made sense that we would see a little bit of delay here too. Is it bad to do like speech therapy or these other things? I'm not saying they're bad. It's just the timing of them and the way that we're approaching is really important. And it can be something that creates more problems, or it can be a part of the solution, which is what we're watching with home. And we watch with all our kids. I do the same thing with my kid. We watch this. And when we understand that behaviors or symptoms are not a bad thing necessarily, but actually a window and a piece of diagnostic gold, like this little gold gift that's been given to us to understand about our children and about ourselves, and then we can ask the appropriate questions and then make the appropriate choices for how to advocate and what to add in. It's just a beautiful thing, Love it. Okay, so wonderful. Unless I have any other questions, this 20-minute talk will be over. 20 minutes. Need to get better at that. Okay, so thank you everybody for being here. Let me make sure I close this. We'll be doing a lot more of these chats, so be connected with us. Michaela will be checking in with anybody that we don't already have a check-in with on this call, and just see how we can support you. Make sure we get you the brain-based parenting lessons. If you don't already have them, Abby, you should have them. And we'll go from there. Okay, everybody have a great day. Here in North Idaho, it's beautiful, so hopefully we get some beautiful outside time. Bye, everybody.
Bye. Thank you.